Have you ever observed that the majority of people keep your mind off their heart until it's too late to suspect heart issues simply occur in the family, or because, however, that isn't the complete tale? After speaking with numerous heart over the years, there has been one surgeon, something they all silently acknowledge when an elderly patient arrives for cardiac surgery. Almost every day, they share the same routines that appear minor, such as a typical aspect of life. Yet, with time, these little habits subtly erode the heart on softwood like sandpaper if you're 60, 70, or even 80 years old. Fortunately, some of these harmful, it is possible to change certain habits, and others, if you see them, stay away from them completely. Early enough, this isn't meant to be frightening. It's about exposing you to the realities of life, trends that physicians observe on a daily basis, and assisting you in avoiding the same outcome in the video today. We'll go over 7 daily routines that almost everyone, an elderly patient undergoing heart surgery, frequently without being aware of that they were doing anything incorrect. You may be able to identify a few, either in own life or the life of someone you care about. In any case, knowing what to search for could make a difference between staying out and requiring surgery completely out of a surgical room. Let's get habit of not eating breakfast or consuming morning meals high in sugar. One among the most prevalent behaviors among heart surgeons cite the number of their elderly patients who either didn't eat breakfast completely or began their day with the frequently something that uses the incorrect type of fuel. Nice, quick, and simple at first after all, it doesn't seem like a huge deal. Many individuals take a muffin and pour a breakfast bowl or simply sip coffee and say, "Good morning," but there's a catch. Your blood pressure, heart rate, and all energy levels are impacted by whether you eat or not. The first thing in the morning, when you miss breakfast or flood in the morning using refined sugar in your system, you produce a crash and spike effect. The body is initially in a condition of stress, frequently rising amounts of cortisol and disrupting your insulin response over time. This increases the strain on the cardiovascular system, particularly if it occurs every day. Your arteries constrict and blood becomes a little thicker, and your heart must put forth more effort to stabilize the swings. In addition, there is the psychological. Those who eat or skip breakfast, poor people often overeat in the afternoon, frequently grabbing for rich or salty foods to compensate for the deficiency. This generates a cycle that is fed by bad morning behaviors into bad evening choices, and your heart is pressed on both sides. You may not first sense it, but when you get older, the little everyday decisions might become the very plaque and rigidity that necessitates surgery. Focus. I recall a man called Harold who retired at the age of 76. He would say, "I've never been a fan of breakfast. It was just coffee and a slice in the morning of coffee or toast, depending on the situation." He felt Oklahoma for years, but his cholesterol began to rise due to pressure, deteriorated, and he began experiencing chest when he arrived for surgery. He was in discomfort. His physician informed him that this did not occur overnight. It occurred each morning for decades in order to safeguard your eat genuine food to start the day. Something nutritious, high in fiber and protein fat, even something as basic as muesli with healthful grains, nuts, eggs, and vegetables. Avocado on grain bread can be beneficial. Keep your system stable. It's not about being flawless. It's about creating a solid base on which your heart can trust, since breakfast isn't the beginning, it's the beginning of your day. The next 24 hours are handled by the body habit 2, suppressing feelings and avoiding important discussions. This one could surprise you, but it's a challenging situation. More often than you would think, surgeons bring up, I believe that many elderly patients who ultimately requiring heart surgery had a connection to common beyond exercise and diet. They bottled up their worry and pain, not just for a moment, regret, wrath, or even grief weeks, but occasionally for years, decades. What individuals frequently fail to recognize is that the heart reacts to more than just physical as well as emotional inputs. When you feel ignored, emotionally unsupported, or unheard, your body doesn't simply brush it off, it carries it. Reactivity of the neurological system increases, your blood pressure remains somewhat higher, and you get more sleep. Delicate over time, that slight strain increases, placing a burden on your heart that no treadmill is able to reverse, studies demonstrating a close relationship between repressing emotions and heart problems. Individuals who don't discuss their feelings are more likely to have more erratic heartbeats, higher risk and inflammatory levels of unexpected heart attacks. It's not vulnerability to discuss, it's survival. When you hold your breath through all the challenging senses that your heart is pleading with you to bear all of that oxygen debt on your behalf, and I know a woman, and eventually it breaks down. Elaine, an 80-year-old woman, had been her family's pillar of support. She never grumbled, but always grinned. But when her spouse died, she didn't cry in public. Of anybody, she insisted on stating, "I'm fine." She passed out while gardening a year later. Heart failure, according to the doctor, it was her arteries, but when she eventually let her daughter, told me at the hospital her heart seemed to slowly break, for we didn't see it for years. You don't have to tell everyone everything, but look for a friend or a therapist. Allow your feelings to flow through you. Rather than being motionless in your chest, the heart requires flow, since it is a pump. If you're still watching, don't press. Watching this film and discovering these revelations important. Kindly provide the second comment below to inform me of your presence, and if you haven't, I suggest you subscribe. Turn on the bell and subscribe so you keep watching videos. Your assistance is helpful. Let us keep producing quality information to educate and motivate you, and then let's go. Habit 3. Utilizing pain excessively relievers rather than root causes causes heart surgeons. Take note of this. Observe that older folks far too frequently relying significantly on painkillers simply to get through the day, relievers stiffness in the back, and knee aches or headaches following a restless night. Many folks take a tablet without giving it any thought, move on and let it go, yet what begins as periodic respite frequently becomes a calm, everyday routine, and that quiet routine may be a serious issue for your heart. Drugs that don't cause inflammation, such as naproxen or ibuprofen, appear innocuous, while occupying your shelf but being taken frequently, particularly when not eating or without direction. They raise blood, your kidneys are affected by pressure, and over time, this caused additional strain on your heart system. For an individual already battling high cholesterol or arterial plaque that can cause additional stress. A gentleman was the last straw. Carl, who was 76, played golf twice a week, appeared to be in good health, but he covered up his knee pain by daily ibuprofen dosages. When he eventually arrived for surgery following a myocardial arrest, his arteries revealed years of damage without being heard. The surgeon stated, "This occurred yesterday, yet his heart's been bearing the burden of those medications." Years have shown that the behavior itself isn't only the medication, it serves as a substitute. Every medication is frequently a lost chance. Stretching, resting, and seeking therapy alter habits or inquire about the source of the pain, truly letting you know that your body isn't simply hurting as you get older. There are instances when it's a warning sign, and numbing is similar to extinguishing a fire. Alarm without first inspecting the stove. Several elderly patients are susceptible to this trap, not because I'm lazy, but because I want to remain engaged, be helpful, or just not annoy people. But your heart doesn't worry for civility. It is concerned with hypertension, inflammation, and circulation. So if you have joint pain, look into asking why your head hurts is common. Don't let short-term respite becomes permanent. This isn't about never taking anything. Medicine, it's important to keep it become your default configuration. Deal with the origin, not just the heart's symptoms. Will be grateful for it with every beat. The fourth habit is not having breakfast, or it may seem too late to skip breakfast. Like a harmless, even healthful habit if you want to shed a few pounds. However, cardiac surgeons have observed more and once more that patients who frequently neglect their breakfast or postpone meals for very lengthy likely to have greater problems with blood pressure, blood sugar, and yes, the heart function. Hunger isn't the issue. It concerns how your body reacts to extended periods without gasoline. When you awaken, your heart has been beating already. It has been pumping and fixing all night and controlling, but when you don't get the very initial amount of sustenance in order to make up for it, cortisol levels rise. This stress hormone has the ability to increase blood pressure and artery strain. Eventually, combine that with coffee on an empty stomach with no protein or fiber to when everything is in balance. Your heart begins to the day with conflict rather than assistance. Eleanor, 68, a woman, believed that skipping breakfast was assisting her in controlling her weight. She would sip a potent cup of coffee, run errands, and perhaps have a bite to eat. By 1 p.m., her blood sugar levels would collapse, feeling lightheaded and munching on usually whatever was nearest was digested or salty. That act gave her a sense of, although her body was in a state of stillness dreaded every morning when she eventually sat down. With a dietitian following her second after her surgery, she became aware of her tendencies were unrelated to balance and are related to stress, and the habit itself turns into a risk due to the body adapting to survive rather than flourish, causes changes in hormones that impact later in the day. Most people's appetite, those who skip breakfast, tend to eat too much at night, which raises cholesterol and levels of two direct risk triglycerides, heart disease risk factors, and for elderly adults experience the repercussions more quickly. Breakfast doesn't have to be more difficult. A feast, there must be some sort of your heart can benefit from some protein and fiber. Perhaps a healthy fat, even a tiny bit of almonds and a fruit slice, can stabilize your system. What's important is consistency and body communication. I'm here to help you with this calm routine. Is disregarded since it doesn't feel risky, yet it's among the first items that cardiac doctors inquire about for a rationale for beginning the day. By consuming your heart is actually a straightforward act of safeguarding. If you're still viewing this, watching the video, and discovering these insights important, kindly respond to the fourth comment below to notify me of your presence. And if you haven't already, I suggest you activate the bell and subscribe so you never miss a video. Thanks to your help. Helps us keep producing high-quality content to educate and motivate you. Let's proceed. Habit number 5, remaining inactive for too long. You may consider getting more sleep as your age is beneficial or even innocuous. Yet, what cardiac surgeons have frequently observed is that elderly patients who invest extended periods of sitting, particularly without breaks for mobility, are much more likely to possess compromised cardiovascular systems. And we are not discussing skipping the gym. We're discussing not even getting out of bed. Should take a walk or stretch every hour or two. When you are still for an extended period of time, blood pools as your circulation slows down, and your heart and legs must be active. More difficult to obtain nutrients and oxygen over time, the remainder of your body will decreases the elasticity of the arteries and promotes the accumulation of plaque in the arteries. It seems as though a silent storm is building. While you're outside, in your veins, everything appears to be quiet. Give Frank, a 75-year-old retired bookkeeper. Following after retiring, he would spend hours watching TV, puzzles with crosswords on the kitchen table, and didn't actually move until he needed to use either the loo or answer the door. He experienced a constriction in his chest. With breathing difficulties, his cardiologist discovered early congestive heart disease, symptoms failure not due to his weight or a smoker. However, due to his heart's silently deteriorating due to idleness, it's not about becoming a sportsman, but rather about movement every half an hour, stand up taking quick walks, and stretching your arms all day long, including little chores. Properly caring for plants maintains your vitality. Your heart is pounding and flowing in a considerate similar to oiling for a healthy rhythm. There's no need to rev the engine. However, you must keep it operational. In actuality, sedentary behavior it impacts more than just your heart, your emotions, blood sugar, and even your capacity for nighttime sleep, although the first organ to endure silent suffering is the heart, since it is unable to yell at you. It simply continues to operate silently until it is unable to. Arteries can be opened by surgeons, install positions, but they are unable to reverse that portion is up to the years of inactivity. And it begins with little routine gestures that reveal your body's habit. 6 is still being ignored in the game. Ongoing mental strain and stress frequently believe that cardiac problems primarily come from physical things such as diet, exercise, and genetics. But how many cardiac surgeons are there? C. Repeatedly, is this the patient? who frequently enter the surgery room bear emotional stress that has been hidden for years. Additionally, they are unaware that it has been stealthily eroding their health. Your heart doesn't just react. You see, it reacts to physical exertion by emotion. These aren't only sentimental, induce actual, quantifiable blood changes, hormone levels, heart rate, and blood pressure. When those alterations occur frequently enough, they cause the cardiovascular system to deteriorate. Similar to how water erodes rock, Joanne, 68, had been widow for 6 years and lived by herself, claiming she was strong, according to her pals. Was self-sufficient, however. She frequently had difficulty falling asleep and experiencing chest stiffness whenever a difficult situation arises. Appeared when she eventually entered for her doctor's examination, revealed higher irregular oscillations of blood pressure and early atherosclerosis symptoms. Physicians inquired about her diet and exercise, but upon closer inspection, it was her ongoing stress, which had been causing a large portion of the harm to the human heart. Is despite its resilience, it is delicate. Keep in mind that prolonged stress keeps your body pumping in a fight-or-flight mode, releasing stress chemicals such as cortisol, and these substances, adrenaline, increase your blood vessel constriction and heart rate. This eventually increases the chance of stroke, hypertension, and even abrupt cardiac arrest, an issue that many older adults were taught to endure as children. Don't whine, don't weep, just keep moving forward, and although perseverance is commendable, keeping emotional suffering at bay doesn't simply make your body disappear. Bear the emotional burden of the wonderful news. Talking to someone is therapeutic for release. Journaling, breathing techniques, prayer, or meditation is more than just a gentle habit. They are durable instruments for effective defense. Additionally, just as you wouldn't leave a crack unattended, a cracked pipe in your house shouldn't cause anxiety in the heart. You are permitted to feel if you are not treated, are permitted to relax, you are permitted to keep your heart safe, not just your body. However, if you're still emotionally watching this film and discovering these revelations important, kindly leave a comment at number 6 below to inform me of your presence, and if you haven't, I suggest you subscribe. Turn on the bell and subscribe so you keep watching videos. Your assistance is helpful. Us keep producing quality information to educate and motivate you, then let's go. Ahead 7 years without a habit examining the condition of your heart. Heart surgeons point to these habits. One could be the most annoying to them since it is entirely preventable. 2, many elderly patients are unaware of it. Regarding their cardiac condition after it's already grave and the explanation for why they were examined after it was too late. We don't neglect to replace our auto's oil. We don't wait for the roof to collapse prior to examining it. But for some reason, many people stop, especially once they retire. Undergoing routine cardiac examinations, according to some, it's because they feel good. Some people fear receiving unpleasant news, just aren't sure what to search for. But the truth is that the heart can be struggling for a long time before it becomes apparent. Symptoms such as elevated blood pressure, increased calcium, and high LDL cholesterol and abnormal EKG or scores can provide hints. A long time before a heart attack occurs, a basic annual physical with blood work. Additionally, if required, an echocardiogram or a stress test may reveal information that, with early detection, would be simple to handle. George, who is 76 years old, claimed to have fallen just a little more slowly now, but nothing. He was prompted by his daughter to get his whole workup revealed that he had over 80% obstruction in one of his heart arteries. He changed his diet, received a stent, and is much better now. But if he hadn't he could have had a very different result. Uncertainty isn't tranquilly, yet it's risky, because unlike some health issues, heart issues don't always make a huge announcement. Symptoms before they become hazardous. The initial indication might occasionally be a silent heart attack. Cardiologists frequently say they wish they had seen their patients earlier. Years or even 6 months prior, there is more to preventive care than just giving you more is the key to avoiding pain. Years, more vitality, and liberty. Your heart has supported you all your life. A yearly check is worthwhile to ensure it can continue doing that. Concluding remarks: bad habits are frequently dismissed as minor, like chewing your fingernails or omitting a stroll, but in reality, Some of every day, the smallest and most ignored decisions have the most impact. That's what your heart is for. Surgeons are attempting to inform us about the majority of their patients didn't have was one significant error that they made for years of minor trends that accumulated. But here's the good news is that there is still time. Regardless of your age, your heart reacts to better options, then you don't need to be flawless. All you have to do is begin by altering one habit at a time. A little more oxygen in your heart, extra rest, and a bit of extra exercise will be appreciated. Recall the 7 among the practices we discussed. Is there one that struck near to home for you? Perhaps it's something you've been meaning to talk about for some time, or something you've never linked to heart health. In any case, simply recognizing it is a first step. The proper path, let's not hold out for the warning sign that appears in an ambulance. Let's do something together. While you are not alone, you still have an option. We're all learning and developing in this, and all attempting to perform a bit better compared to yesterday. I appreciate you joining us today. Would be greatly appreciated. You share one and leave a remark underneath. Anything you discovered today and your planning strategy to apply it in your daily life. Your ideas are vital to us, so please don't hesitate to share them after reading your remarks. Give us a lot of inspiration and support if you found and liked this video useful. Kindly like, subscribe, and share. Your assistance enables us to keep producing excellent material to educate and motivate you. We appreciate you viewing, and we look forward to and hope to see you in the upcoming video.